Yeah, we are at Panacea Spine Pain Orthopedic Center. So we are going to do radiofrequency ablation of trigeminal. Dr. Deepika will brief you about the case history. We have already done a video for general awareness of the public, the importance of radiofrequency ablation, and we will be talking while doing the procedure in and out about the trigeminal neuralgia.
A 70-year-old female patient, she came with the history of one-sided, left-sided facial pain. She's been suffering for 5 years and she was on medical treatment, carbamazepine, and it worked for some time, for few years. They increased the dose, but she's not able to tolerate. She's more than 70, so the surgical treatment is not advisable. That is why we are doing radiofrequency ablation for this patient to reduce her pain.
So you could understand about the brief history about the patient. So as such, trigeminal neuralgia, it's a unilateral facial pain which we have already done a video on this. This is for public awareness as well as for medical graduates or postgraduates who are interested to learn about the radiofrequency ablation for trigeminal neuralgia. So as such, it's a electrical lancinating type of pain. The patient has got a tendency for suicide. Apart from that, we normally see the epidemiology is 40 and above, 50 years, 60, 70 years, and that too particularly females. The probability is more, and here this trigeminal neuralgia, the two types, the classical trigeminal neuralgia, wherein you don't know exactly the problem, but in some of them there is a vascular loop around the root entry zone. So in such cases, usually we send these patients to a neurosurgeon for surgical intervention. That is nothing but the microvascular decompression. So, but above 50 years, in view of age, in view of anesthesia complications, and keeping that into consideration, usually patients, we subject them to either balloon compression or radiofrequency ablation or glycerol injection. But there are certain complications with each procedure, has got do's good and bad. But you're talking about balloon compression, there is more of motor palsy. Whereas in with this so-called radiofrequency ablation, the problem is numbness along the facial distribution of the trigeminal nerve. So we'll go ahead with the procedure. Patient is conscious. We will be doing the procedure under sedation. So you can see the patient is positioned supine, and this is done previously. They used to do under blind procedure, but nowadays we are doing under fluoroscopy, and we do have a machine that's a radiofrequency ablation machine. You could see there. Yeah, that's a machine. Yeah. So ultimately there are around 4 to 5 non-invasive procedures other than surgery, the MBD. One is radiofrequency ablation, the other is balloon compression and the glycerol injection, and also spinal cord stimulator. Yeah, this is the other. Okay.
The position for the procedure is the patient should be supine with the head end slightly extended. For visualization of the trigeminal ganglion, what we are going to do is we have to get a good view of the Meckel's cave. For that, the position which we give to the patient is supine position with the head extended, and the C-arm should be rotated in a caudal position, caudal tilt, that is about 30 degrees. And ipsilateral tilt about 10 degrees, and so that it should be, the foramen ovale should be visualized, through which actually the mandibular nerve comes out, and that should be visualized well between the maxilla and the mandible.
Now patient is positioned supine with head extended, and the fluoroscopy is positioned at 30 degrees caudal tilt and 10 degrees ipsilateral tilt. After finding out the foramen ovale in the fluoroscopy, a 22 gauge RF needle is introduced through the foramen ovale going towards the Meckel cave, and this is a fluoroscopic position adopted. Now we will take a lateral to confirm the depth. There are 3 D's. One is direction, depth, direction. For direction, we will see EP view, and for depth, we see lateral view. Let us take lateral view. See. Stop Tagira. Now we are checking for, see, as you know that the trigeminal has got 3 branches. One is ophthalmic, one is maxillary and mandibular. The ophthalmic and maxillary are sensory divisions, whereas the mandibular has got a motor division. So we are going to check the masseter muscles. You could see there we have put at 2 Hertz and now we are going to increase the current milliamps. Start increasing, increase, increase, increase. You see the masseters are contracting. So we are damn sure that we are in the foramen ovale and we are stimulating the mandibular motor component. Reduce. So that's how the masseter gets contracted. Yeah, that's what. And now we'll do a sensory stimulation also to damn sure confirm whether we are at the junction of mandible or maxillary or ophthalmic branch. So not only this, but also we have confirmed in the fluoroscopy also, but still we want to have a double confirmation. Sensory 50 Hertz and start on the machine. Slowly increase. 0.1, increase. నొప్పి వస్తుందా తల్లి? ఎక్కడ వస్తుంది? దవడకు వస్తుందా లేదంటే ఇక్కడ వస్తుందా పైన వస్తుందా? ఎక్కడ వస్తుంది? ఇక్కడ వస్తుందా? ఇక్కడ వస్తుందా? See the, so now we are checking the sensory. At 50 Hertz we started increasing the milliamps by 0.5. She was complaining exactly at the maxillary division. So that's it. Then we sedate the patient, we give some analgesic. Then we'll do radiofrequency ablation. We'll do 3 lesions at 65 degrees centigrade, 70 and 75 for 1 minute each. So we'll do 3 lesions and that's the end of the procedure. Thank you. This is a thermocouple. It is being introduced into the RF needle which has got 5 mm active tip. You could see there. This is being done under fluoroscopy as well as after sensory and motor stimulation of the trigeminal nerve in each division, ophthalmic, maxillary and mandibular. So it is being inserted. Now we are going to do radio frequency ablation. She is already 70 years? 70 year old and there is no, we cannot subject her to MVD, so we are doing RF. So now you can see the radio frequency ablation machine. We have set at 60 degrees centigrade for 60 seconds. The lesioning has started and you could see there are 2 markings. One is yellow line diagram as well as pink one. The yellow is the attained temperature of 60 is attained already. After giving local anesthesia, we are doing radio frequency ablation. If required, you can use some fentanyl and propofol because already we have done sensory as well as motor stimulation. The first lesion is set at 60 degrees centigrade for 60 seconds. And then first lesion is completed. Now we will take a second lesion at 65 for 60 seconds. Look at here, this is the mandible. Okay, we have put almost 30 degrees caudal fluoroscopy. We could see the mental almost like a U shape or V shape. This is the final position. And if you see the space between the maxilla and the mandible, wherein you can find out the foramen ovale through which the radio frequency needle has been introduced, and in order to know the depth, we have taken a, now you could see here, this is 𝗦𝗟𝗘𝗘𝗣 and this is clivus and this is Petrus part of the temporal bone. From here it has entered, this is foramen level, it has entered inside. So this is a RF needle. We are doing ablation and the picture is in the lateral fluoroscopic view.
This is the second lesion we are doing of the trigeminal nerve ganglion, and we have kept the temperature at 65 and the time set at 60 seconds. Patient is completely conscious. She is cooperating now.
So we can see that the temperature is set at 70 degrees Celsius and the time is set at 60 seconds, and the patient is again totally conscious.
And this patient has got the 3 components, the ophthalmic component, the maxillary component as well as the mandibular component.
As we know, like the trigeminal nerve, it has 3 components, also ophthalmic, maxillary and mandibular. In the Gserian ganglion, the superomedial most is the ophthalmic, it correlates with the ophthalmic division, and the middle part correlates with the maxillary, and the inferolateral part correlates with the mandibular division. And that's how the arrangement is in the Gserian ganglion, and we can choose lesions accordingly, according to the distribution of the pain. So this is a fluoroscopic image of the foramen ovale. And foramen ovale is the axis through which we enter the Meckel's cave, where the 𝗣𝗜𝗓𝗓 ganglion is stationed. 𝗣𝗜𝗓𝗓 ganglion is the ganglion of the trigeminal nerve. And foramen ovale, to get the fluoroscopic image, we need a mental view where we have to we need to get a caudal tilt of 30 degrees of the fluoroscope. And then we do an ipsilateral tilt of 10 degrees to get the foramen ovale, into view. And this foramen ovale we can find between the, so this is a submental view where the mentum is seen as a V-shaped structure, and the foramen ovale here, and after giving the ipsilateral tilt we find the foramen ovale between the mandible and the maxilla.
This is the lateral fluoroscopic view. This is to check the depth of the needle. So before doing the ablation, we should always check the depth of the needle, and then only we should start. Sensory and motor stimulation, we will start the ablation. As you can see here, this is the sella turcica, and this is the clivus, and this is the petrous part of the temporal bone. This is the Meckel's cave, and here is the first and the second cervical vertebra. And as you can see, this is the needle which we have introduced into the Meckel's cave. So according when we have confirmed this depth is correct, and then we will check for the motor and sensory stimulation. Sensory stimulation, we have to check for each division according to which division we are trying to block. And motor, only one division has that motor supply, that is the mandibular division, which gives nerve supply to the masseter. So we will check in the motor for masseter contraction, and in the sensory for each division what it supplies. According to that, we will check for the stimulation. If we are in the right place, if the needle is in the right place, then we will get the stimulation in that particular division where it supplies, and according to that we will ablate the nerve.
Here you could see here, she is a happy patient. We have done radiofrequency ablation of V1, V2, V3. We have explained to the patient attendants regarding the as well as the numbness along the distribution of V1, V2, V3, and patient is completely pain free. She has got excruciating pain when she was entering into the theatre. Now she is completely pain free. Etla undamma? Taginda noppi? You can listen from her own voice. Cheppandamma, etlundi? Taginda? See.